Dr. Ibbad Yuosuf, welcome to ITV Gold. I hope you're doing well today.
Doing great. Thank you again for having me.
Of course, we have to have you because so much is happening across the nation, especially with coronavirus. So let's dig right into it. I have some numbers coming in here. In the United States, we're at 27.2 million cases of COVID-19 with at least 468,000 deaths. In the world, we're at 107 million cases and more than 2 million deaths. My question to you is, how are you observing this number? And we keep on hearing that we're in a downward trajectory, but you're in the ER, you're in the front line. What are you seeing?
So here in New York City, at least where I am in Brooklyn, the numbers have been steady, slow and steady. Nothing has really peaked in New York the way we had that initial peak last March and April, which, is almost a year from now. We are still seeing coronavirus COVID cases every single day. Overall, I think they're a little bit less severe coming through the ED, but still there's a range of patients who are coming in either very sick or with just very mild symptoms. We're not as overwhelmed, I think, overall, as we were back during the peak about a year ago. So that's given us the time and space and ability to provide good care.
Right. And do you currently and your hospital currently have enough PPEs, ICU beds, and ventilators so far?
So yeah, comparatively speaking to the peak, things have been pretty steady. So I think hospitals have been required to have a 3-month supply of PPE ready. So back during the lull we had in the summer, I know a lot of hospital systems, some of the larger and smaller systems, were basically buying up and collecting PPE with the anticipation that there might be a second full surge or even little bumps in the coronavirus cases occurring. So we have had PPE. It's not so much as an issue for us specifically, but I do know it is an issue throughout the country still. For some hospitals who weren't able to get ahead of their peaks and their curves.
Exactly. And, states such as California are still basically at their peak. Hospitals are super overwhelmed. As a person who experienced it firsthand, what's some advice that you'd like to give them?
The best advice is to just keep working. New York, the first peak, we were able to contain it. I do have some colleagues who were actually here with us in New York who are now in California, and they said it's very similar. I think California just surpassed New York in cases and deaths. Right. So it's just a matter of taking a day at a time and trying to get ahead of it. I know now we have leadership is acting differently from the state, local government levels and the federal government levels. We have had time to build processes in. So the hospitals are just working every day as hard as they can, and people are working every day as hard as they can. Just stick with it. New York is a good example of what can happen in getting major control over it, at least. So.
Right. But right when we speak, doctors, still we're seeing more than 100,000 infections per day in the country. We're seeing anywhere from 2,800 to 3,000 deaths per day. When do you see that going down, and what exactly is the reason behind it? Do you attribute it to the young adult population, perhaps?
So the data is showing that younger adults are carriers right now. They tend to be the ones getting more infected right now. The older adults, the people with comorbidities, those at risk, tend to be a little bit better with, obeying stay-at-home orders and isolating and wearing masks, things like that. And this is more true, especially for the hot spots around the country, Florida, California, Texas, right now. Right. So that's, one of the reasons. I do think that we are going to continue, personally, to have little spikes as time goes on and little bumps in cases as things open back up and close. I think it's a very fluid thing, especially now with these new variants popping up. Right. The variants having different viral properties, causing different levels of infection, things like that.
Right, and you just mentioned variants. I'd like to talk to you about it. Could you give us some insight into what kind of variants you are seeing? We're hearing that the South African variant might be more transmissible and or deadly. What have you seen so far?
So I know New York, just following the data for my city in the state, we do have a few cases of the UK variant. I'm not too sure if the Brazilian and the South African variants have popped up locally yet. But like in the beginning of this whole thing last year, I think it's kind of just on a rolling basis. We have to be open to learning new information and collecting proper data and then analyzing that data as time goes on. So,
right. And experts are also saying that these variants can cause COVID reinfections into people that have had COVID before. Your comments on that?
So like I said, we're going to be learning as the day, goes on, day by day, hour by hour, keeping up with the science and the data. There are reported cases of people being reinfected, some with a milder course of disease and some with a worse course of disease.
Right.
Again, there is still a lot to be learned about how this virus affects certain people and not others. So that's something we're going to be on the lookout for as these variants pop up around the world in different places, different countries.
Yes, let's now talk about mask doctors. Today, the CDC basically suggested that double masking is, adding in another protective layer to your mask. It's beneficial. What are your comments? I would love to just get a little bit on that.
So right now we have good data that's showing that masking and double masking is working. I know a lot of that has to do with the physical nature, the mechanics of how a mask works. Often people don't realize the microscopic nature of how masks work. Often they're mesh systems. So naturally wearing two different systems of two different textiles or cloths or fabric or paper or cotton materials, whatever they're all made out of, adds an extra layer of protection. Similar to how an N95 is manufactured, it's manufactured in a more randomized pattern, basically, which is how it's able to provide the protection that it does.
Right, definitely. Let's now, doctor, talk about the vaccines. I have a couple of questions about it. The first one is, I know you have gotten the vaccine yourself. Which one did you get? And as somebody in the front line, how is that feeling for you? What were your emotions during that time period?
So I did get the vaccine. I got the Pfizer that became available to us first. I was actually the first individual to get it at my hospital system. So that was kind of exciting. It was a little nerve-wracking, I think, because such a new thing back in December when I got the first dose. I reacted pretty well to it. The first one, I just had a little bit of soreness on the arm where I got the shot. The second one, I had a few more side effects, a little bit of nausea, fatigue. It is not a live vaccine. It's an mRNA vaccine that uses the protein, the spike protein, to build immunity. So I knew it wasn't the actual, COVID coronavirus disease that I was feeling, but I did feel my immune system working. As far as the reaction that happened. So that didn't feel good, but I was able to take some Tylenol, go to work, and have a pretty functional, successful day at work. So.
And have you seen any kind of differences in side effects between Moderna and Pfizer?
So far, the data is showing that, for the most part, people are getting a spectrum, again, of symptoms. A lot of that includes fatigue, headache, nausea, some people with chills, some people with fever, but the symptoms do seem to be the same across both. I believe fatigue and headache are up there. I think it's about 30% between the two.
Right. So. More on vaccine, doctor, AstraZeneca, before it was stopped in South Africa because they're saying that their variant it's not being effective against it, said that its vaccine appears to reduce transmission of the coronavirus, and one dose can protect up to 3 months. Any comments or insight into that with AstraZeneca?
So I think that's a very important note. We are learning a lot about these vaccines. Initially, they tested the ability or the ability of the vaccines to prevent severe disease course. And now that we have a large amount of people around the world getting vaccines across all the different vaccines, we're getting more data on how they're actually able to, if they're able to, prevent transmission of disease. So it's not something that we can comment on fully right now, I think, but it's going to be important to watch the data. I know as far as the AstraZeneca, they were saying that it does prevent some transmission when spaced about 12 weeks, 3 months apart.
Right.
So again, it's going to be a day by day, week by week, month to month thing, and following the data and seeing where it takes us over this next year.
And what about Johnson & Johnson? They have applied for an authorization from the FDA. Their vaccine is only 1 dose. If that was approved, do you think that could be a game changer perhaps?
Yeah, I definitely think, a 1-dose vaccine would be a great addition to the tools that we currently have. Any increased ability to vaccinate is going to help decrease deaths and morbidity and mortality from the disease over a long period of time. That's just the basic nature of how all of these vaccines work, whether it's the Moderna or Pfizer or Johnson & Johnson or AstraZeneca. With the disease that we don't yet have a vaccine that prevents full transmission for, similar to our other vaccines, being able to get the deadly nature of the virus down is very important. And that's what these vaccines are doing.
Right. And talking about the vaccines, I have to ask you, doctor, the vaccine rollout is still slow. A lot of states aren't able to figure out what to do with the doses. What have you seen in the hospital yourself? And, what are you hearing around the medical community about what's needed to speed up this process?
So as far as the medical community, I know some of my colleagues in the private sector, private family medicine offices, people in concierge medicine, other specialties outside of emergency medicine, internal medicine, family medicine, are starting to use their clinics as they're able to get federal vaccines, basically. So a lot of this is going to depend on the federal and state rollout and their ability to obtain vaccine. From there, I think, people are being very creative in their ability to get it to localities, communities, and people in the hospital, and frontline workers, teachers, public service workers, etc. Those who don't necessarily have the luxury or ability to work individually from home and isolate until they can get vaccinated.
Right.
But there is still a lot to be worked on. I know one country in Europe was actually utilizing the physical space of a bar to have nurses and workers come in and use that front space, the retail space, to physically administer the vaccine. So there's a lot of creative solutions out there. A lot of people looking for work. I think, it's time that we consider as a community utilizing some of the retail stores that might be closed during a lockdown or a shutdown, or utilizing, physical geographic spaces to help this vaccine get rolled out to more communities.
It's actually a very smart idea. I know they're trying to set up mass vaccination sites, but they should utilize places, as you said rightly, that aren't being used right now. Just talking about the vaccine, doctor, another subject that's been, up for debate right now has been the fact to do with the school reopenings. They're saying that the schools can safely reopen even without the educators, the teachers getting vaccinated. What are your comments on that? And do you think the schools are that safe to open without them being vaccinated?
Personally, I think it's it's a topic that is going to take more thought than a simple question and the time that we have today. We still are learning a lot on how kids and younger adolescents and children either carry or get infected by the virus. And then, you have your staff in schools, the teachers, the aides, etc., who tend to be a little bit elder, in age range that we are seeing can carry it further and get infected a little bit worse. So I think, just going by the data, I don't know if it's necessarily safe to do a full open the gate kind of opening. I think we might need to look at it the way we're looking at the rest of things and doing a tiered opening, or have, kids come in for certain days of the week and definitely have the input of the people involved in those situations, have the input of the teachers and the administrators, and even the students, the student leaders. I'm currently not in a school environment. I'm in a hospital environment, so I can't give you, a full answer. I think getting those communities and those people involved to help answer some of those questions is the next step.
Right. And another topic that's concerning everybody, Doctor, here is indoor dining. Here in New York City, it is set to open up, I think, by this weekend. They are stating that, our case numbers have been low enough for them to do that. Do you think it's safe to to open up indoor dining right now when these variants are, spreading across the country?
So safe would be a little bit subjective. Like I mentioned earlier, I think we are going to have little bumps and, little spikes as things reopen. I do think, us as the general public needs to be understanding and aware of the fact that things might open and then possibly be closed 2, 3, 4 weeks later. As we track the data, I think we have to be a little bit more open to the fact that these things are going to be fluid, and not necessarily harp on, hey, we're going to open it this day and it's going to stay open through the summer, through next year. I think that's a little impractical. So we have to kind of just watch the data and see. Do I anticipate we'll see a little bit more, some more cases or another surge or, little bumps and spikes, as I said? Yeah, I do think so. Right. But we need to figure out a good way to do this as a collective, as a group.
I just have 2 more questions left here for you. The first one has to do with South Asians at high risk. There's a huge number of our population that is at high risk due to diabetes, lung diseases, heart issues. What have you seen in the ER concerning those patients and COVID-19? Is there any interaction? And, do you think they are at more risk of getting it?
So they're definitely at a higher risk, people with the comorbidities that you mentioned, diabetes, blood pressure, cholesterol, heart disease, etc. Right now, from what I'm seeing personally, is that the patients who are coming in sicker do tend to have those comorbidities. We are still seeing, there was a paper today on how patients with dementia or psychiatric illness are also at higher risk. That makes kind of logical sense medically. Patients with dementia aren't necessarily able to communicate what they're feeling and their symptoms, or necessarily show symptoms as easily. Patients with psychiatric illness as well. There's definitely a risk, and with our community having a large population, a large portion of them having these risk factors, these comorbidities, I think it's definitely something to still consider. Stay masked up, still wash your hands, try to minimize interactions with, some of the younger people who may have had it and who are healthy, things like that.
For sure. And finally, my last question to you has to be, as a doctor right now, when things are looking like they're calming down, what's your biggest worry? And any advice you'd like to give our audience after that?
So the biggest worry is that we get too complacent, similar to, the holidays. We tend to see little spikes. I think people tend to forget that we're still in a pandemic. Myself am guilty of it. I know, other healthcare workers, people are tired. It's tough to continue wearing masks and socially isolate and do all these things that are helping. That our fear is that we go back to another full-blown peaking situation which we can't control, a full-blown lockdown which we can't control. There's still some businesses open right now. There's still, some certain things that the governor is allowing. And I think at the moment it's working. People do have access to testing. People have access to masks. We know a little bit more about the disease course and the symptoms to look out for. So people are definitely being better about that in New York and New York City. But the worry, again, is that we get complacent and we let our guard down. So hopefully we just stay conscious of the effort that we've been making. I know New Yorkers have been taking great strides and great steps in trying to prevent the spread of this.
Yes, for sure. It is not the time to let our guard down right now. Thank you so much for your time here, Dr. Yuosuf.
Thank you again for having me.